Hello, everybody. Good morning and namaste. Welcome to our Gold Coast Women's Health Network platform this week. Today, we are celebrating My Health for Life Week. All right, so before we start the conversation, let me introduce myself. Hi, Saalihah. So, Saalihah is our guest today. So, I will send her the request. Saalihah, you will have to send me a message that you would like to join. Okay, yes, you have. Let me introduce myself. My name is Anjali, or in short, you can call me Ange. I'm going to send Saalihah a request again. Hello,
Hello.
Saalihah.
Morning. Hi,
Welcome.
Ange.
Yeah, it's so great to see you as
Thank
always.
you.
Yes. So I was just introducing myself, and so my name, and then I'm from, and my profession is women's health movement coach, and certified, no, qualified nutrition counselor, and the founder of this platform. So today we have amazing guest Saalihah, who is the coach for My Health for Life week, the My Health for Life, and we are going to celebrate this week, right?
Yes.
Yes. So, all right, tell us about you, Saalihah.
Yeah, sure. So thank you again, Ange. And yeah, it is My Health for Life week from yesterday, the 12th to the 18th of May.
Mhm.
And it's a week that's created every year during May to raise awareness on the My Health for Life program. And this year, the theme is actually healthy habits. So lots to hear on that topic. So in terms of what I do, so I'm actually a clinical pharmacist by profession. I visit patients at home, look at their medication, and then write a clinical report to the GP. So that's actually initiated by the GP.
Mhm.
And that's actually a federal government funded service. And it's usually patients that take many medications or have chronic diseases or have been in hospital. So there's about 15 to 20 criteria
Mhm.
of who can have that service. So yeah, I've been doing that for about 20 years now. I've also been an inpatient clinical pharmacist at a private hospital. And also, about 6 years ago, I was accredited to be a My Health for Life facilitator. So the
Mhm.
program has been around in Queensland. It's Queensland wide only. It's been around for about 11 to 12 years, and I've been facilitating it for about 6 years. And all the allied health professionals are facilitators or can apply to be facilitators of the program.
Yeah.
So usually physiotherapists, exercise physios, dietitians, yeah, around that, GPs. We've got a few nurses as well. I'm actually the only pharmacist that's facilitating the program.
Yeah. That's amazing. So yeah, because when I look at your bio, it's like you do so much, right? And I was like, how am I going to, make it shorter? But yes.
That's a
So
little bit of
and
everything.
yes. Thank you so much for the beautiful intro, and we are so humbled to have you here today. And before we start, I just wanted to let everyone know that this My Health for Life Week talk is all about to bring awareness, and we talk about, but not a specific suggestion or advice for anybody. But if you need the support, you can directly contact people can directly contact you, or at the end we always have a Q&A session, and you can ask any question to Saalihah in a comment below. And yes, and we will talk at the end how you can contact Saalihah. All right. Okay, so let's start. So thank you for being here again. And can you tell us about your role as a My Health for Life facilitator, and what inspired you to get involved in this program?
So with the work I mainly do is about chronic disease management, and I see a lot of patients on medication with many diseases. And the government put this money into a chronic disease prevention pool back then, about 10 to 12 years ago. And I thought it was a really good opportunity for us to help people avoid getting these conditions. As we know, I think in Queensland, the current statistics say 1 in 4 Queenslanders has a chronic disease. So obviously we've got big issues out there in the community, and I think if we prevent from now,
Yes.
we can avoid bigger problems in the future. So I really like the approach that the government's used to this. Is how they look at it is we invest in people doing this program, so it's free for people to do. So it's an
Yes.
investment in your side. All it is your time, basically. And if you take better care of yourself through learning or acquiring the knowledge and skills through the program, you then save doctor visits, hospital visits, medication, and it's a decreased healthcare burden in the future. So it fits very well into what I do because, as I said, I do the chronic disease management with visiting patients. I've been in the hospital, so that's inpatient management. And then
Yes.
this just adds that other dimension to my clinical practice as helping with chronic disease prevention.
Yes, I think this is so much needed at the moment because every year it's just growing, right? The amount of disease is growing up. But if we can, just prevent it,
Mm-hmm.
and we could just bring it down so much better, and then if we can all do this. I have done it myself, and you can do it in person, you can do it online, and Saalihah is very hands-on
Thank
coach. She would just give you a call or text or anyhow email everything possibly. So yeah, people will be in a really good hand, and so yeah. So another question leading to this is, in your experience as a clinical pharmacist and facilitator, what are some most impactful habits people can do to adopt for their
you.
life?
So that's quite a broad question. I'll try to summarize it with a few points. I think the first thing is educating yourself about your health and knowing your body, understanding your body, your health conditions. Because when you know what's happening on the inside, you then know how to take better care, what steps to take. So just on the side, like when I facilitate the program, mine is not just the what and the how to do whatever to be healthier. It's also the why behind why we do certain things.
Yes.
So, for example, with the stress management, it's not just breathe, do deep diaphragmatic breathing to manage stress, but we understand and how to do it. But it's understanding the how of the nervous system to understand what happens when we're under stress and to do it to help you manage that better. So I'm very much about that, and I apply that through each of the principles when you did the program. And the other thing, so education is very important. The other thing I was going to say was scheduling regular health checkups with your healthcare providers. It could be screenings or blood tests, checking your blood pressure, your cholesterol, blood sugar, especially if there's a history of chronic conditions in the family.
Yes.
I think of it as a car service. You send your car to be serviced every 12 months.
Yes.
And so too, should your body be checked. We don't know the inside till we actually do a blood test. So, having your routine biochemistry and all those tests done to check what's happening on the inside is very important. So there's regular checkups. And I think the other habits are around just being more aware of being physically active, how much of sitting. A lot of people these days, you're working at desks and you're not moving, and that sedentary lifestyle. So just taking incidental breaks, trying to get up in the day, stand up and do a phone call, for example, or if you're working from home and you've got chores to do in the day, do some of your work and then pop out, go and hang out some clothes and come back and keep working,
Yes.
instead of sitting for hours at a time. I think balanced diet is super important. A lot of people these days, especially with stress or time constraints, they don't eat well and they're eating things high in sugar and high in fat to sustain them to get over the line. So making sure you're eating minimum processed foods and eating according to the Australian Healthy Eating Guidelines, which you can access online. Staying hydrated is super important. So making sure, usually you could have lots of sugary drinks and caffeine to get you through as well during times of stress, and making sure you're having enough hydration. That is super important for your digestion and your energy levels as well. And two more things I'd say is your stress management. So trying to build in relaxation techniques through the day, even if it's mindful practices or taking a little walk, yoga, deep breathing, any of those, or even activities that help bring joy and relaxation. It could be mindful coloring, for example, or any craft activity. And then super important, the last point is your building a support network. So trying to stay socially connected with family or friends, or being part of an online group, for example, or support network for that accountability in achieving your health goals. Oh, and I have to add, practicing gratitude. That's super important. But daily gratitude helps to improve mental health and reduce stress as well.
Yeah, and apparently it has been scientifically proven these days.
It has.
So I have been, yes, listening to the podcast that about their gratitude list,
Yes.
and you know how Oprah Winfrey's that
Yep.
she just talks about so much about their gratitude
Yes.
list. So that's
Huge
amazing.
link.
So
So just a little fun fact there. We have a part in our brain called the insula, INSULAR, and that part of the brain is concerned with happiness, resilience, empathy, compassion. And by us being grateful for even just 30 seconds a day, it actually helps grow that part of the brain so you are more happy, compassionate, empathetic, and resilient. And who doesn't want that? That's like super easy to even the traffic light, if you're waiting for the light to change from red to green, just using
yes.
moments in the day to just think about what am I grateful for today. Today, I mean, look at the beautiful sunshine that came out. It's such a lovely day outside.
So if you are just pop in here today, we have beautiful coach Saalihah from My Health for Life, and we're talking about the adopting healthy lifestyle, and the few points we just covered is why we do what we do, right? So, and then regular visit to the doctors or the practitioners, an active lifestyle, balanced diet, hydration, and stress management, and the building and community
Social
building, what
support.
social support, and the gratitude list.
Yes.
Yeah, and if you can't do a long list, you start with one apparently, and then slowly, as it becomes habit, it gets, bigger and bigger. So that's awesome, Saalihah. Thank you so much. And how important is mindset informing and sticking to healthy habits? And do you have any practical tips for fostering a positive one? I think you have already touched a little bit on the other question, but yes.
Yes. So I think, yeah, mindset is actually crucial in forming and sticking to habits because it shapes how we approach our challenges, our setbacks, and also change. And little fun fact, so our brains, we actually are programmed with a negative bias.
Yes.
So we always see the negative first before we see the positive. So hence why we need to put more effort and emphasis onto creating positive moments and positive mindset. The first thing I'd say is starting with finding your why. So knowing what is that reason, why do you want to create healthy habits? Examples are, oh, I want to prevent future health problems. For example, my mom or dad had diabetes and I want to avoid acquiring that. Or I want to have energy to play with my kids or my grandkids. So being clear on why do you want the healthy habits. The other thing is also when you have those negative thoughts come into the mind, like I can't do this, this is too hard. Try and change it to I'll try my best, or whatever I do is a step in the right direction. So rather focus on progress, not perfection, and remind yourself that change is a journey. It all takes time.
Yes. I love that, how you said progress, not
Yes.
perfection.
Yes, and
Yes.
I always say with anyone doing any health behavior change program, look at yourself as work in progress. So even
Yes.
while you're going through the program, it's about acquiring those skills and knowledge and tools, but it's only the beginning of what's ahead of you to make even more change down the line. The other little tips on mindset of focus on what you control. So,
Mm,
what you can control. So, example, focus on your meal prepping, things you can do, like
mm,
making those better choices, planning your meals in advance, creating a menu, and going out and buying those ingredients. And those coming back to those affirmations. So saying things like, I am capable of creating these healthy habits,
yes,
because you often have self-doubt and those little voices come into your head. So keep using these little, things, prompts to say, I can do this, and repeat them daily to reinforce as well.
yes.
Yeah,
So we get that negative ideas because our body is trying to keep us comfort and then
absolutely.
trying to keep us safe, right?
Yes.
So yeah, I'm not scientist, but it's like I listen to lots of podcasts and things like that around health and well-being.
Mhm.
So that is what they were saying, that because our body is, in past fight or
Yeah,
flight mode,
that's right.
to keep us safe.
Yes.
So yes, that is the reason, I think that, yeah.
Absolutely.
So yes, awesome. And can you please share a bit about how My Health for Life program supports the participants in building healthier lives?
Yeah, so the program is designed in three modalities. So it's either online, face to face, or telephone health coaching. So it's quite flexible in that there's really no excuse.
Yes,
Uh,
I,
you know,
I know. I've been through that.
so yes, it's about seeing what suits your lifestyle and what you can
Yes,
do. And everyone likes different things, and people go through different phases of their life as well.
yes.
So the main things that we look at are being more active, so being more
Mm,
physically active, eating healthy, managing stress, sleeping better, reducing alcohol to safe amounts, quitting smoking. There's also, I've shared information, people have asked me over the years on the importance or how to limit or watch for caffeine, how
mm,
much is too much caffeine,
yes.
the importance of hydration. A lot of people, I'd say 80%, want to lose weight. So people want to lose
Mm,
weight. I've even had 6 people over the 6 years I've done this want to put on weight.
mm,
So different
mm,
things mean different things to different people, and it's about
yes.
seeing what you want to get out of it.
Mm,
I've even had people come up like 2 or 3 times over the 6 years I've done the program and want to work on different goals.
mm,
So 5 years ago, it could have been being more active. Oh, sorry,
yes.
5 years ago, it could have been wanting to lose weight, and then they've come back like in the last 2 years, and then they want to work on a totally different thing,
Mm,
sleeping better or
yes.
moving more. So it just depends what's happening for you at that stage.
Yes.
There's no one size fits all, and it's about seeing where you're at that particular moment, and that's where the health checks comes in, and I'll talk about that a bit later. But seeing where you're at, and then using that as a starting point, and then taking that step towards being a better you, healthier you.
Yes.
Mhm.
Amazing. And this program is, the best thing is it's free, as well as online, as well as in person. And everywhere you just chase the people like you are the only one.
Yeah.
And when you go to the room, there is like a 15, 16 people already there, and then online
Yeah.
people. It's incredible how you do, how you run this
Thank
program. I'm really impressed with that. Yeah. So, how can people get involved with My Health for Life program and access its
you. Yeah,
resources?
sure. So I'd say the starting point would be to do the free online check. I think we have posted it in the write-up, Ange. You had it there. There was a link there.
Yes,
So
on the
there, yeah,
top. Yes,
yeah,
yes,
yeah.
the
So there
link
is
for the
a
how to
yeah,
apply.
and
Yeah.
I'll post it again in the comments. So there is a health check link. So if you took that health check, it then tells you yes or no whether you can or can't do the program. So it is
Mm,
for anyone 18 and over.
yes.
And the only people who cannot do the program are people who've already got a chronic disease. So if you've got diabetes type 1, type 2, you've had a stroke, so mini TIA, transient ischemic attack, cerebral hemorrhage, or mini stroke, or if you've had heart bypass, heart surgery, stent, and also heart failure, pacemaker, and kidney disease or kidneys that are below function, basically that's already considered a chronic disease, and this is about prevention of those diseases.
Yes.
So if you've got those conditions, unfortunately, you're unable to do this program, but there are actually heaps of other programs out there that are also free that you can do.
Yes.
For example, I'll just on the side share this. So my Heart Foundation has a program called My Heart, My Life, which was launched last September. And it's for anyone who's had a cardiovascular event, such as a bypass or heart attack. And it's actually to help guide them, or it's kind of post rehab after they've had their surgery, to help them get back on track with their health.
Yes.
So many people actually don't know that. And that's actually a free program too through Heart Foundation. And that's statewide, it's the whole of Australia. So yeah, I think the first step would be to do the free online health check and seeing, are you eligible? And then from there, you'll either get myself or someone call you from the head office
Yes.
to see what are you keen to do. And then they'll give you the options to see whether it's, as I said, phone coaching, online, or face-to-face, and seeing what's available in your area if it's
Yes.
face-to-face as well.
And so that's amazing information. And lots of times we just don't know the resources, right?
Yes.
Because it's incredible coming from Nepal. We don't have support at all from government, but here we have it, but we just don't know about it.
Yes.
Because, like, for example, My Health for Life, you know, like so many people, they have no idea. I think because I know it because I came across you, and then, you know, you wouldn't give me a chance to skip. So I'm really grateful.
That's okay.
And yes, so, and if any of your patients or anyone, you know, if you think they will be eligible,
Yep.
and you know, yeah, you can contact Saalihah directly. And you know, so if anyone has question, please pop it in the comment down below. And while we are waiting for the question, Saalihah, please let us know where people can find you.
Yeah, so I will put my details in the email and phone number. You're most welcome to reach out to me.
Okay.
Yeah, pretty simple and easy to get hold of, so
Yeah.
that's no problem.
The phone number is the best way
Yeah,
to reach out to you,
either
right?
phone number or the email, either
Yeah,
or.
if anyone is interested to book in with
Yeah,
you, and they can just directly message
yeah,
you, and
directly
then
message me, and I'm happy to go through the health check with them if they
yes,
don't want to do it online. But yeah, it takes about 3 to 5 minutes. It's a pretty straightforward health check. And yeah, I'm happy to discuss the program, what options are currently available, and go from there. Yeah.
yes, and you're a very hands-on person, you know,
Yeah.
coach. So it's yeah. Oh, like Amara is saying, awesome program, and Break Free said, sounds like great initiative, and it's free. So you know, we should take advantage of this program. It's incredible, and Saalihah, I cannot speak anymore about her,
Thank
how
you.
great the coach you are, and you know, and yeah. So if any of your patient or any of your family members or you know colleagues who needs this program and you think they might get benefit out of it, just contact Saalihah, and I'm going to put all the details in the content below in our, you know, under our live section. And yes, I think, thank you so much, Saalihah. I think this would be it. And thank you everyone for being here and listening about this amazing program. Please spread the words, and the more healthier people we have and less hospital bills we have, and prevention is better than cure, right? We always have known that, and that will be, yes. And anything you would like to say before we end,
Yeah, I just
Saalihah?
I just want to say thank you again. And yeah, for anyone still deliberating or contemplating about change or making change to healthy habits, I always say start small, but start today.
Yes.
Even if it's an extra glass of water or just walking for 5 to 10 minutes, or even just swapping one unhealthy snack for a healthy snack, but just making one little change to get the momentum going. So yeah, start small, but start today.
Yes, start small, and that is doable as
Yeah.
well. Very, you know, and that will be effective in the long
Yeah.
run. All right, everyone. Thank you so much for being here.
Thank
Thank you,
you.
Saalihah, for your
You're
time,
welcome.
and yeah, all the knowledge and your amazing coaching program. And we'll talk to you soon. Thank
Sure.
you, everybody.
Bye.
Bye. Bye.